In this video, I'll be discussing the different diseases that cause deafness, which is also known as hearing loss. When you see a patient complaining of hearing loss, you will differentiate whether the cause is conductive hearing loss or sensory-neural hearing loss. This is done via the Weber and the Rinne test. The test is done using a tuning fork which is placed outside the pinna and on the bony provinces of the ear for the Rinne test. So remember, Rinne is by the pinna, and then on the forehead for the Weber test. In sensory-neural hearing loss, the problem is due to something occurring after the ossicles of the inner ear, so i.e. the vestibule, the cochlea, or the nerves. So the Rinne test will show air conduction is better than bone conduction, and the Weber test will localize to the normal ear. In conductive hearing loss, there is a problem that is occurring at or before the ossicles. So the Rinne test will show bone conduction is better than air conduction, and the Weber test will localize to the ear that is affected. When we say localize, this means the sound is louder in one ear. If you want more information, you can find it in the links at the end of this video or down below. Once you find out if it's sensory-neural hearing loss or conductive hearing loss, you can find the causes. For sensory-neural hearing loss, the causes are acoustic neuroma, which is where there is a tumor compressing the vestibular cochlear nerve in the internal acoustic meatus. Meniere's disease, which is due to the buildup of fluid in the semicircular canals and cochlea. Presbycusis, which is an age-related sensory-neural hearing loss. Labyrinthitis, which is a problem at the vestibular labyrinth. And other causes, such as cytomegalovirus infection and ototoxicity. These are the causes of sensory-neural hearing loss. For conductive hearing loss, the causes are otosclerosis, which is an abnormal growth of the ossicles, otitis media with effusion, which means there is an infection in the inner ear and fluid accumulation, cholesteatoma, which is where there is a collection of skin in the ear, and necrotizing otitis externa. This occurs in immunocompromised and diabetic patients. So otosclerosis, otitis media with effusion, cholesteatoma, and necrotizing otitis externa. These are the causes of conductive hearing loss. I hope you now have a better understanding of this, and for more information on the different diseases, click on the links in the video or down below. If you like the video, then click the like button, and for more videos, subscribe to the channel and leave your comment below. Thank you.